Hello everyone, in this video we are going to talk about various herpes viruses. So herpes viruses are the enveloped, double-stranded and linear viruses. So various herpes viruses I am going to enlist. Those are the herpes simplex virus 1, herpes simplex virus 2, human herpes virus 3, which is also called as varicella zoster virus, Epstein-Barr virus, which is also known as human herpes virus 4, cytomegalovirus, it is also known as human herpes virus 5, human herpes virus 6, 7 and 8. So herpes virus constitutes of herpes simplex virus 1, herpes simplex virus 2, human herpes virus 3, 4, 5, 6, 7 and 8. So we are going to talk in detail about their routes of transmission, their clinical significance and important note that you should know. So the first of all, let us talk about the herpes simplex virus 1. So the herpes simplex virus 1, they are transmitted through the respiratory secretions and the saliva. The main clinical significance we are going to talk about, they causes gingival keratoconjunctivitis, herpes labialis, also known as the cold sores, and herpetic whitlow on the finger, temporal lobe encephalitis, esophagitis and erythema multiforme. One important note on the herpes simplex virus is that the most common cause of sporadic encephalitis can present at altered mental status, seizure and or aphasia. So they are mostly commonly latent on trigeminal ganglia. So herpes simplex virus 1 is latent on trigeminal ganglia. Now let us talk about the herpes simplex virus 2. The herpes simplex virus 2 are transmitted mainly through the sexual contact and perinatal. So the clinical significance of this herpes simplex virus 2 is that it causes herpes genitalis and neonatal herpes. So herpes simplex virus 2 are most commonly latent in the sacral ganglia. They causes viral meningitis. And viral meningitis is more common with herpes simplex virus 2 than with herpes simplex virus 1. Now let us talk about the human herpes virus 3. This human herpes virus 3 is also known as the varicella zoster virus. So the main route of transmission of this varicella zoster virus are through the respiratory secretions, contact with the fluid from the vesicles. And the clinical significance of this human herpes virus 3 is that it causes the varicella zoster, that is also known as the chicken pox, and it also causes the shingles and encephalitis and pneumonia. The most common complication of the sickle is post-herpetic pneumonia. The important note you should know with the varicella zoster virus is that it is latent in the dorsal root or trigeminal ganglia. The canine of V1 branch involvement can be seen in herpes zoster ophthalmicus. Now let us talk about the Epstein-Barr virus. The Epstein-Barr virus is transmitted through the respiratory secretion through the saliva, and the Epstein-Barr virus is also known as the kissing disease, and it is most common in teen and young adults. The main clinical significance of this Epstein-Barr virus is that it causes mononucleosis. The mononucleosis constitutes of fever, hepatosplenomegaly, pharyngitis and lymphadenopathy. Especially the posterior cervical node lymphadenopathy is seen. So we should avoid contact with sports until resolution due to risk of splenic rupture due to the hepatosplenomegaly. And the mononucleosis is associated with the Epstein-Barr virus, and it is associated with the lymphomas and nasopharyngeal carcinoma. So the lymphoma, especially endemic Burkitt lymphoma, is involved, and nasopharyngeal carcinoma, especially it is seen in the Asian adults, and the lymphoproliferative disease is seen in the transformed placenta, that is associated with the Epstein-Barr virus. One of the important note that you should know in the Epstein-Barr virus is that it infects B cell through the CD21, and atypical lymphocyte on the peripheral blood smear is not infected with the B cell but reactive cytotoxic T cell. And in the positive monospore test, you see the heterophile antibody detected by the agglutination of sheep or horse RBC. So use of amoxicillin in mononucleosis can cause characteristic maculopapular rash. So now let us talk about the cytomegalovirus, that is the human herpes virus 5. The cytomegalovirus is transmitted through mainly through the sexual contact, saliva, urine and through the transplant and through the congenital. The mononucleosis in the immunocompetent patient is seen on the cytomegalovirus. The infection in the immunocompromised, especially pneumonia in the transplant patient, esophagitis in the AIDS. We can also see the retinitis in the AIDS patient. We can see the hemorrhage, you can see the cotton wool exudates and the vision loss in the congenital cytomegalovirus. So the infected cells in the cytomegalovirus has the characteristic owl eye intracellular lesion, and it is latent in the mononuclear cells. Now let us talk about the human herpes virus 6 and 7. The human herpes virus 6 and 7 is transmitted through the saliva, and the Roseola infantum we also say that as exanthum subitum. There is high fever for several days that can cause seizure, followed by the diffuse macular rash. The diffuse macular rash starts on the trunk, then is spread to the extremities. Now let us talk about the human herpes virus 8. So the human herpes virus 8 is transmitted through the sexual contact, and Kaposi sarcoma. There is association of the human herpes virus 8 and the Kaposi sarcoma. So the Kaposi sarcoma that is seen in the HIV/AIDS and transplant patients. So dark violaceous specks or nodules are seen that representing the vascular proliferation. So the human herpes virus can also affect the GI tract and lungs. So this is all for the various herpes viruses. Once again, you should know that the herpes viruses are the enveloped, double-stranded and linear viruses. The herpes viruses constitutes of 8 viruses: the herpes simplex virus 1, herpes simplex virus 2, human herpes virus 3, which is also known as the varicella zoster virus, human herpes virus 4, which is also known as the Epstein-Barr virus, human herpes virus 5, which is also known as the Cytomegalovirus, human herpes virus 6, 7 and 8. I hope you understood this topic on herpes viruses. Thank you.